The clavipectoral fascia, the name suggests that is, it is related to clavicle and something like pectoralis, either pectoralis major or minor. You know, the chest region is called pectus, chest or pectus. So any muscle which is covering the chest, the front of the chest, okay, it is called as pectoralis. The name comes from pectus or chest. So there are two muscles in this pectoral region. One is pectoralis major and one is pectoralis minor. So pectoralis major muscle, which takes origin from anterior surface of the sternum and also from the anterior surface of the medial 2/3 of the clavicle. So it has called sternal head, one clavicular head. And also the pectoralis major also takes its origin from the costal cartilages, from second, third, fourth, fifth, sixth costal cartilages. And it is directed and it is a triangular muscle, okay, and ultimately it is inserted over the lateral lip of the bicipital group. So in this dissection of clavipectoral fascia, we will first encounter the skin, we will remove the skin, then we will get the superficial fascia. In the superficial fascia, we will get the fat, the several cutaneous nerve, and here we will get the supraclavicular nerve. The supraclavicular, which is present above the clavicle, and it comes down, it has got three branches. One is medial branch, one is intermediate, and one is lateral branch. That is superficial, within the superficial fascia. When we will remove the superficial fascia, we will get the muscle width which is enclosed in a fascia, that is called deep fascia. Fascia means a membrane-like structure which covers either the superficial structures or the deep structure or the muscle. Okay. So in here this fascia is also called as pectoral fascia, that is deep fascia is named as pectoral fascia. Now we will remove the clavicular head and we will remove the part of the upper part of the sternal head and we will remove the pectoralis major muscle. And below the pectoralis major, we will get again another short and triangular muscle that is called pectoralis minor, which takes origin from third, fourth and fifth ribs and the costal cartilages. And it is triangular muscle is taking origin from here and it is inserted over the, we know this is the thoracoid process. Okay. See, this is the anterior border, this is the posterior border, or it is inserted over the anterior border of the thoracoid process. So this muscle is then it is continued towards the humerus, but that part actually is not a muscle, that becomes a ligament, okay, which is called coracohumeral ligament. So coracohumeral ligament is nothing but a degenerated part of the pectoralis minor. Okay. So this, we are concerned with the pectoralis minor muscle because here is the muscle and this is the clavicle and one fascia will come from underneath of the clavicle, We have seen in the undersurface of the clavicle there is a subclavian groove. We have seen there are which has got anterior and posterior lips, and that fascia is attached to the anterior and posterior lip, and it goes down and then it again splits and it covers the pectoralis minor. Okay, it is coming from here. It goes down, it splits and covers the pectoralis minor. Then again it joins and it is continues towards the axilla. That same fascia is continued towards the axilla, and we know the axilla or the armpit. We know there is a concavity of the armpit. Okay, so it is continued to the axilla, and it maintains the concave, and this fascia is attached to this axilla or axillary fascia. So it maintains the concavity of our axilla. So or it actually suspends or holds the axillary fascia. There is a fascia which is present in the axilla, which is called the axillary fascia. Okay. So this clavipectoral fascia is first attached to the clavicle, then it covers the pectoralis minor, then it goes towards the axilla. It is known as suspensory ligament of the axilla. Okay. So, and here it is attached to the clavicle. Okay. We know the subclavian groove. So, and this subclavian groove is for attachment of subclavius muscle. This muscle actually takes its origin from the first rib. Okay, this is the first rib. Okay, and it is then, and that muscle is the origin is tendinous origin. From here, the muscle takes origin. It is a tendinous origin, and ultimately it is attached to the subclavian groove, and the muscle becomes muscular and attached to the subclavian groove. Okay, so the fascia actually also covers this subclavius muscle also. Okay, and it goes down, then it covers the pectoralis minor, and it is continued towards the axilla as axillary as a suspensory ligament of the axilla. Now there are some structures which pierces this clavipectoral fascia. One vein which originates from the lateral part of the from the lateral part of the dorsum of the hand. That vein is called the cephalic vein. Then it is continued on the lateral part of the forearm. Then it is continued on the lateral part of the arm. Then it remains in between two muscles. One is deltoid and one muscle is pectoralis major. So that groove is called the deltopectoral groove. So that vein ultimately resides in the deltopectoral groove and ultimately pierces the clavipectoral fascia, and ultimately that vein drains into a big vein, that is the axillary vein. So first you have to remember one vein which pierces this fascia, and other structures, that means it is piercing from superficial to deep. Okay, vein is a superficial structure. It goes through this area and ultimately it pierces the clavipectoral fascia from superficial to deep. From deep to superficial, what are the structures that are piercing? There is one artery which is called thoracoacromial artery. You will learn. It is a branch from the axillary artery. Just remember, thoracoacromial artery, which pierces this fascia and comes out and it has got 4 branches. One is clavicular branch, one is acromial branch, one is pectoral branch, and one is deltoid branch. So we will find that artery. Okay, that artery is called thoracoacromial. It is coming. It is supplying the thorax and it is continued towards the acromial process. So thoracoacromial artery. Okay, and also one nerve from deeper plane to superficial plane, it will come out and it will pierce this fascia, that is lateral pectoral nerve. Just remember the nerve. Gradually we will understand from where it is coming. Okay, this nerve is coming from the lateral cord of the brachial plexus. It is very hard to digest this thing now, okay, but you will learn what is my brachial plexus and you will, everything will be clear to you. Now this is the pectoralis minor. Taking origin from 3rd, 4th and 5th ribs and costal cartilages and inserted over the thoracoid process. Another artery, actually I told you the branches of arch of aorta. Can you remember? No, sir. There are 3 branches: brachiocephalic, left common carotid, left subclavian. Can you remember? 3 branches. Comes out from the heart. Okay, there is heart and 3 branches. One is brachiocephalic, left. From the heart, one artery comes out, that is the arch of aorta. From there, 3 branches come out, that is from right to left, this brachiocephalic, left common carotid, left subclavian. That means brachiocephalic, left common carotid and left subclavian. This common carotid will go towards the neck and the subclavian artery will come out. The subclavian artery, it will come out and it will cross the rib, first rib. Okay, and then it will enter into this area which is called the axilla. Then it is continued in the arm, which is called brachium. Okay, so when this subclavian artery comes out and crosses the outer border of the first rib, it is no more called as subclavian artery, rather it is called as axillary artery, because this area is called axilla. Okay, and ultimately there is one muscle which is called teres major muscle. When it crosses the level of teres major, the same artery is called as brachial artery. Okay, so this axillary artery comes out and traverses throughout the axilla. Axilla is a space between the lateral part of the chest and the upper part of the arm, in between. So that is the axilla. বাংলায় কি বলে এই জায়গাটাকে বলো বগল. So that is axilla. So that axillary artery comes out and it traverses the axilla. So it is named as axillary artery. Now this pectoralis minor muscle, okay, is a triangular muscle. It divides the axillary artery into 3 parts. One, from the outer border of the first rib to the upper border of the pectoralis minor, behind the pectoralis minor and below the lower border of the pectoralis minor. Brachiocephalic, left common carotid, we are not interested. We are interested with the subclavian artery. Okay. Left subclavian. We are not concerned with left common carotid artery. We are not concerned with brachiocephalic artery. Okay. Actually, this is coming from the heart, the arch of aorta, the aorta and the arch of aorta. Okay. And we are concerned with the left subclavian artery. When this left subclavian artery will cross the outer body, this is the first rib, suppose. Okay. When it crosses the first rib, it is called as axillary artery. Okay. And here we are getting, this is the third, fourth, fifth rib, suppose. From here, this muscle, it is pectoralis minor muscle, okay, which is attached to the thoracoid process. Okay. So this, when it crosses, this is the first rib. So when this subclavian artery crosses the first rib, it is called as axillary artery. Okay. And when ultimately when this axillary artery crosses another muscle, which is called the pectoralis, teres major muscle, it is called as brachial artery. Okay. So this axillary artery has got three parts. One, from the outer border of the first rib to the upper border of the pectoralis minor. This is called the first part. Behind the pectoralis minor, this is called second part. And from the lower border of the pectoralis minor up to the lower border of the teres major, this is called third part. So this axillary artery is important because from the first part we will get one branch. From the second part we will get two branches, and from the third part we will get three branches. This is very ridiculous. First part, one branch. From the second part, two branches, and from the third part, three branches. From the first part, we will get superior thoracic artery. From the second part, we will get lateral thoracic artery and thoracoacromial artery, which we will see today. So, lateral thoracic artery, and this is the thoracoacromial artery. And from the third part, one artery will go anteriorly, one artery will go posteriorly, and one artery will come down. So that we will learn later on, that is anterior humeral circumflex, posterior humeral circumflex, and that is a subscapular. So thoracoacromial artery, what I want to impress on your mind, that is thoracoacromial artery is a branch from the axillary artery, the second part of the axillary artery. Okay, and it is actually this remains under the coverage of pectoralis minor muscle. Okay.